Now, who is ready for another pinworm bedtime story? I know I am. Vic is asking, the pinworms, they can get all the way to the fallopian tubes. What size are they? How? What problems does this cause? Yes, ma'am, they sure can. The female worm, like I said in my previous video, will exit the anus and she will lay the eggs in the folds of the booty hole. And then sometimes she'll get lost on her way back in. She gets confused and she gets in the vajayjay. Okay. Now they can crawl up the urethra and get into the bladder, and they can cause symptoms like a urinary tract infection where you can have hematuria, so blood in the urine, you can have burning with urination, and other issues. If they get into your vajayjay and they get up through the vagina, through the cervix, and into your uterus, they can cause inflammation of the endometrium, which is endometritis. So this is inflammation of the lining of the uterus. Okay, they can get up into the fallopian tubes and cause inflammation, salpingitis, inflammation of the fallopian tubes, and they can even get out of the fallopian tubes into your abdominal cavity, into the peritoneal cavity, which causes inflammation there. So the worms, the males are smaller, so they're like 2 to 5 millimeters, and the females tend to be bigger. They can get up to even 13 millimeters long. But these are still relatively very small, white little worms, and they will wiggle. So some parents ask me sometimes, like, how do I know if it's toilet paper or lint or skin or
They're
what?
moving.
If it's moving, it's a worm. And though I personally have never had a patient have a smear come back with any ova or worms on like a pelvic exam smear. Now I'm a pediatrician, so I'm not doing like PAPs on patients, but I'll do pelvic exams. I had someone comment that they have in the lab, they have seen ova, which are the eggs, and also worms on a PAP smear, which is kind of disturbing. The pinworms in the uterus can cause irregular menstrual cycles, and they can also cause postmenopausal bleeding. It's not a common cause, but it is a cause. So if you're having those kinds of symptoms,
Just
definitely
Terrify.
see your doctor and get it checked out.
Terrify Cleanse.
Night night.